Hey, everyone. The internet being a little bit spotty, so if that happens, we'll regroup. We just wanted to connect with folks because it's been a little while since we gave a COVID update, and I wanted to cover a couple of things, so I'll just dive in here. Since the start of the COVID-19 pandemic, New Haven's had 11,573 cases, and we've lost 184 New Haven residents. I'm going to hand it over to Director Bond to give some general updates on vaccinations and et cetera. So, Director Bond.
Thank you, Mayor. So overall, as we launched our vaccination efforts in December, actually December 28th, we have vaccinated almost 9,700 residents with both first and second doses combined. And we are working diligently to ensure that we are vaccinating our Board of Ed staff and teachers. We have a schedule where we are working with not only the Board of Ed staff and teachers for the next coming weeks, but we are also coordinating efforts with the daycare providers. And so I want to commend the team at the health department for just working diligently and efficiently and in partnership with the Board of Ed to ensure that we are offering vaccinations to the staff and being at convenient sites with them. I also want to thank our partners because our partners, Fairhaven, Cornell, and Yale have been also supporting these efforts and vaccinating those individuals that are qualified and meet the new criteria for eligibility. And so we've been working through that effort. As you know, transitioning over to sector rules, our sector rules, the governor announced recently, are going to be lifted. And so we are working closely in our team to ensure that we are communicating the reopening of businesses, which is going to be effective March 19th. And so they are eliminating capacity limits. However, we are maintaining the mask spacing and cleaning protocols. As you know, within the city of New Haven, we also are require that businesses continue to report positive cases. So I want to thank all of the local businesses for continuously reporting positive cases. That portal is available on our website. We will continue to monitor that closely and work with business partners to ensuring that there's proper isolation and quarantine. We also want to encourage businesses to ensure that they are having strict precautionary measures with disinfecting as customers will be more frequently these businesses. And so what we're also aware of is the reopening of other sectors in early April. And so the team and I, along in partnership with the economic development, are working closely to ensure that we develop guidance and provide support to each of the different sectors. Parks, outdoor event venues, and indoor stadiums will have increased capacity. Summer festivals are also going to be allowed, as well as summer camps. And so we will continue to provide updates and potential webinars in the very near future for those respective sectors. So just reminder, please continue to wear your mask, although we are working hard to ensure that our community are all vaccinated. For those that would like to be vaccinated, we are still not out of the radar. So we want to make sure that individuals are washing your hands often. If you cannot wash your hands, making sure you have hand sanitizer and making sure that you're reducing as much as possible any indoor gatherings in a significant amount of time. Bars will remain closed, and so we ask our bar owners to continue to be patient. The governor has not approved bars to be open. This is just for restaurants, and the 11 p.m. curfew will still apply. So the 11 p.m. curfew will not change, and we will continue to do so. 50% capacity of indoor theaters will continue. And there is still a 25-person cap on indoor social gatherings. And so we will continue to provide those updates and make information available on our COVID Hub website. And so with that, I'm going to turn it back over to the mayor.
Thanks, Dr. Bond. I wanted to add a couple things there. So as folks know, the phase we're in right now is 55 and for vaccines is 55 and older and school personnel. And it also includes individuals experiencing homelessness. With the school personnel vaccinations, things have been going very well. In particular, wanted to commend Fairhaven Health Center as a number of the members of the press were at Wilbur Cross last week. They're vaccinating on average around 300 people a day at that site. And in addition, our school nurses are at individual schools vaccinating school personnel as well. So we're really plugging away on that, which is great. Cornell Scott is taking the lead on vaccinating individuals experiencing homelessness, and they've been at the hotels where the individuals are staying. So far, they've vaccinated around 150 people. That number includes some service providers as well, but the majority are individuals experiencing homelessness. And before we hand it over to Mike, I wanted to underscore that I think one of the most important things messages that we want to get out there is we don't want people, given the opening up changes by the governor's office, to feel like it's yet time to celebrate. We're not out of the woods yet, and we have a long way to go. And it's very, very important that people continue to do social distancing and mask wearing and be cautious. While we're all very excited about the idea of being beyond the pandemic, we are far from it. And people need to be very, very cautious about not going full speed ahead here. And one other thing is, even though capacity limits are lifted for many different business establishments, it doesn't necessarily mean that they can reach that 100% capacity, because they still have to implement social distancing of people inside. I'm going to hand it over to Mike Biscatelli to talk a little bit about the work we're doing on the economic development side.
Well, thank you, Mayor. Nice to see everyone. Hope you can hear me okay. The internet is a little bit unstable in City Hall here today. But to just put a finer point of emphasis on what Director Bond and the Mayor said, although we foresee a significant amount of reopening activity come March 19th or even sooner, it's very important that we support businesses through the transition period and maintain the protocols, particularly the mask wearing and the separation distances. That will significantly affect restaurant occupancy. So even though we're open at full capacity, just by the spacing of the tables, you'll see some reduced business activity. So we want to continue to support those businesses and plan for continuing economic disruption. I want to thank our partners at the Chamber of Commerce. They've been working with KeyBank, Carmody, and Markham, as well as our team, on some free business planning and assistance that's available to small businesses citywide and throughout the region. As part of this program, any business that didn't take advantage of PPP yet, still struggling to maybe navigate the process, there'll be open office hours, both in person and over Zoom, for businesses that want to take advantage of this technical assistance. The in-person hours are on March 10th from 5 to 7. People can sign up on the Chamber's website. Through our small business development program here at City Hall, we also offer 5 hours of free technical assistance, just so that businesses can get properly in the queue when you go to a bank and apply for PPP. The most current tranche of PPP, the expiration date is March 31st. So we want to make sure that we stay focused and get as many people in that portal as possible. Then the second part associated with that is we had great success last year with over 37 to 40 businesses that took advantage of the outdoor dining program. We'd like to expand that this year. We're going to hold a webinar on March 16th, so it's coming up next week at 1 o'clock, where we'll roll out the permitting process for 2021 It'll be online, fully digital again this year. We've made some efficiencies in that program. We're expecting to close both Orange and College again, sort of more full street closures to provide additional room for outdoor dining. This year as well, we're going to put a focus on making available our facade improvement program funding so that people who want to improve their indoor-outdoor experience, create more ventilation, just add more seats, particularly outdoor seats, they'll be able to do that. And we also have some design guidance. So we brought on an architect to assist with design guidance to assist small businesses. So whereas last year we were a little bit rushed, to be a little bit more thoughtful about this year and to make it a more permanent experience outside. As the mayor said and Director Bond, given the ongoing effects of the pandemic, we still have about 6,500 New Haven residents who are filing for continuing unemployment benefits. The only way really to bring those workers back is to follow the protocols, make sure everyone stays on the game plan right through summer.
Thanks, Mike. I don't have anything else to add. Do folks have any questions? Go ahead, Tom.
Thank you very much, everyone. Maybe first, a few school-related questions. So either for the mayor or Director Bond or Dr. White. First, how many New Haven Public Schools teachers have been vaccinated so far, and how many school staff?
I will take the first stab at that, and then Director Bond or Dr. White can weigh in as well. So we are not allowed to track that. We can ask, and we have done this with other departments, we can survey our staff to say how many people have been vaccinated, but because of HIPAA, we're not allowed to track individuals and whether or not they've gotten vaccinated. So given that, when you look at the numbers, Fairhaven Health was vaccinating approximately 300 people per day last week. And Dr. White, correct me if I'm wrong, they started Tuesday, was it? Wednesday. The vast majority of the individuals vaccinated were school staff, not everyone, but the majority. And there were, again, Dr. White, correct me if I'm wrong, I think 14 schools that had nurses that were inside vaccinating individuals, and approximately 20 to 30 individuals were vaccinated in each one of those schools.
Correct.
And so you can kind of back into the math there, an estimate. I believe it's around 3,500 people in all that we're targeting to get vaccinated. Is that right, Doctor? Dr. White, why don't I just hand it over to you? I think it's better if I just hand it over to you.
No problem, Mr. Mayor. Yes, we are targeting approximately 3,500 staff, as well as appendant groups such as bus drivers, after-school providers, all people affiliated with the school operations in one capacity or another. So we are working through that. We have another clinic coming up at the schools and rotating through and continuing the site to give staff multiple opportunities to become vaccinated.
Thank you for that. And then maybe one more question for Dr. White while I have you. I understand that high schools are going to be opening in some capacity on April 5th. Could you speak a bit to why that date was chosen? And yeah, why then? Why do you feel comfortable opening high schools then?
We've always wanted to have our kids back, and we've been striving towards that. With bringing on our middle schoolers last week, we wanted to project out our target date for bringing in our high schools. As always, these are always proposed dates, and we have to follow the data and work with the health department to make sure we're in place to do that. But we wanted our high schoolers to have an experience this year as well. It's been a very long time since they've been able to be in person.
I think I can add a little bit around that. So, we have a committee that consists of Dr. Dalal, our medical director, clinical staff, our epidemiologists. So we look at all of the metrics. We are really pleased with the reopening since our pre-K through fifth graders. We have been very successful in ensuring that our positive cases are very low. We've been able to conduct contact tracing in a timely manner. We have been able to ensure that there's nurses within the respective schools. And so this phased-in approach has allowed us to be able to assess and ensure that each of the phases are going to have the Board of Ed able to make these respective decisions. We know that right now we are seeing, we're in a downward trend with now are favorable to be able to make this decision at this particular time to be able to offer in hybrid model for our high school students as well.
Thank you. And then my last question, probably for Director Bond. I know the CDC just released earlier today guidelines for what fully vaccinated people should feel comfortable doing. I see the top of those recommendations are you can gather indoors with fully vaccinated people without wearing a mask, and you can gather indoors with unvaccinated people from one other household without masks. I don't know how much time you've had to spend with this, but could you just respond, what's your response to the CDC's new kind of highly anticipated recommendations for what fully vaccinated people can do?
I think providing some clear guidelines is going to be helpful. It's going to be helpful for us to be able to then guide decision making on how we proceed moving forward. I think it's giving a lot of us hope in the community so that we can be able to visit our loved ones, especially those of us that have not had the opportunity to really spend time with our elderly grandparents and things of that nature, and people being not able to socialize outside of their household. I am very pleased with the CDC guidance. It's important for us as health officials and decision makers to be able to provide guidance to the public. And so I think although the guidance did get issued, it's important that we sort of understand what these guidances are going to mean, because we do not want to send mixed messaging around those that are not vaccinated, or if there's a large mix of group of individuals. So we want to just make sure that we emphasize, and we'll be sharing the guidance for sure to the community so that we can be consistent with our messaging around safety.
Thanks.
I had a quick question as well.
Go for it.
Kind of in that same just topic about the CDC guideline, do you anticipate people who are vaccinated having to carry around their vaccination card?
They should. I know that if you're going to travel in certain parts of the states, when they monitor, and when you get off, you have to do a travel advisory form. They are asking if you've been vaccinated and to show evidence of that. So that is something that is being transitioned to. So it is important for individuals to carry that certification with them so that if asked, you are able to show evidence of that. So especially if you are going to be traveling to see family members.
Yeah, thank you. And going back a little bit to education, how is contact tracing within the schools working? Is it if any student tests positive, everyone in the classroom is informed that there was a positive?
So we have set protocols for contact tracing. We do a notification of those are immediately impacted, and every situation will vary. So depending on the situation, the communications will be shared for those that really need to be notified. And it's been working really well. It's being led by the team at the Board of Ed side. And so we provide technical support from the health department side as needed.
Thank you.
You're welcome.
Any other questions from folks? Go ahead, Tom.
It's my last one. I'm also happy to defer if anyone else. All right. Well, my last one is about the Floyd Little Athletic Center. The Connecticut Mirror ran a really interesting story that I know Director Baum was quoted in this morning about how some of the mass vaccination sites in East Hartford and Floyd Little, at least in the early weeks, were vaccinating primarily white people from the suburbs, as opposed to people in the surrounding neighborhoods. And I wonder, could you just give us an update on how the Floyd Little site in particular, how it's doing, what the city is doing to make sure that people in the neighborhoods, especially Black and brown people who live in New Haven, are getting vaccinated at sites like that?
So there's a couple of things that I want to address around that comment. So the first one is that we have a vaccine logistics team that consists of all of the vaccination partners. So Yale, Cornell, Fairhaven, the state Department of Public Health governor's team, and then our health department leading that meeting, where we really talk about logistics and really making sure that equity is at the forefront. And so we definitely are working closely on ensuring that not only are we expanding and making sure that New Haven residents are prioritized at our vaccination sites. However, we are also making sure that we're getting into the community. So it's not just about these standalone sites. We need to be into the community, just like we did early on, as you recall, with our our testing sites. We wanted to get into the communities, and so we've been really focused on doing pop-up vaccination sites to ensure that we're in the midst of the community, so that access to vaccine is not a barrier as well, because as you know, we have a significant number of transportation insecurity in our city. And so what we've been doing is strategizing and making sure that we partner with faith leaders, elderly housing, and others alike to making sure that we organize these pop-up vaccination sites for those that really need it most.
Just one more thing to add, and I don't know if you received the robocalls, but they the Floyd Little site last weekend was open to New Haven residents only in the hospital, and we coordinated to make sure that that message got out to the New Haven community. Anything else? All right, good to see everyone. Take care.
Stay safe.